So revisiting the basic upper body stretches. Nice simple collection of stretches just designed to take the pressure off the upper back and neck, especially if you're very desk bound, if you spend a lot of time in your car, anything that encourages this kyphotic rounded posture, the over exaggerated rounding of your upper back, which then puts pressure on your neck and onto your shoulders, commonly overloads the deeper shoulder activating muscles like the rotator cuff, causing problems, instability, in pain, can cause or lead to things like tennis elbow, golfer's elbow, increase the risk of repetitive strain injuries in your wrists, your forearms, your hands. It can cause tension going up into the neck, headaches, jaw pain, so a lot. All you need to do is think about correct posture, but think about how long you've potentially had bad posture for before you try and correct it. It's not a case of you thought, oh, I'm tired today, oh no, I'm fine. It's taken years for you to develop that rounded posture and overload your back. So it's not going to be and gone. You need to create a positive habit. Change the way you influence your body, because you can come into the treatment room, I can correct you, I can align you, I can put you in the right place. But your body thinks that this is normal. It's shortened the muscles on the front of your body to adapt the way your muscles react to tension. It's lengthened the muscles on your back, because if you're putting them here, they can't be engaged all the time, you'd be in pain, they'd be overworked. So it lengthens them. So you trying to hold this, it's always going to come back to here, because the front is tight and the back is loose. So what we need to do is give you some movement in the front. We need to release the front of your body, reactivate the back of your body, and mobilize your spine to allow this posture. We also need to retrain your nervous system to realize that this is where we should be, the correct posture. I'm going to pull a figure out at the top of my head. It's not accurate, please don't quote me on it. You need to redo something about 20,000 times, it might even be more, to retrain a bad habit. So you need to be setting and setting and setting that many times. It's a lot. So rather than just think about it for 30 seconds after I've corrected you in the treatment room, or when someone says to you, your posture's awful, that's not. Create a positive habit before you touch Facebook on your phone or Instagram if you're a social media person, before you click on your emails, before you go through a set of traffic lights, before you start doing the washing up or the hoovering. It doesn't matter what it is, something you do on a daily basis, and preferably several times a day. Set the shoulders, lengthen through the collarbones, engage your abdominal muscles, which is explained in the Pilates video. Gently tuck the tail under, lengthen the neck and draw the chin in. This is correct alignment, similar to mountain pose in yoga. And hold it for 30 seconds, or the whole time you're doing that activity, whichever works better for you. But if you're, say, clicking on Facebook 20 times a day, 15 times a day, answering text messages, answering emails, whatever, then you can correct yourself and reset this posture all day without having to find any more time than you already have. So you can't say to me, I don't have time to do that. You're making time by doing it alongside another thing. Okay? Stretch number 1 is for your rhomboids. It's the middle of your upper back. It's the large muscles that squeeze in between your shoulder blades. And we need to strengthen those if you want to have a chance of holding your shoulders back and down. So all you're going to do is take your hands. They can be in front, push through, or over. There is no real change in the effectiveness of the stretch. Let your shoulder blades come round and drop your head down. The height of the arms will dictate where the stretch is focused in your back. If you draw a straight line from fingertips to shoulder blades, that will show you where the stretch is focused into. Allow the shoulders to come around your ribs and your head to gently fall down so you feel the stretch. And I would say maybe adjust it to where you feel you need it today. The other way you can do it is imagine you've got a banister in front of you or something you can hold on to and just gently lean back against it. So you're not having to physically pull your arms away. You can let your weight or gravity do the work for you and get that stretch. So it's a more passive stretch. The release in between the shoulder blades should feel like a gentle stretch. Stretching doesn't work. If I push it harder, go deeper, do it longer, it's instantly going to produce better results. It doesn't work like that. If you stretch too hard, you'll get temporary release, but long-term aggravation because you damage the muscle. So the most effective duration of stretching is 30 to 60 seconds, up to 3 times. In theory, every sort of 10 seconds roughly, your body should go through a relaxation phase where it realizes you're not doing damage, and you should be able to progress that stretch just a little further to the point of where it's at full stretch, but it should still only feel gentle, to the point of bind, where you feel the muscle, but there's no pain. You shouldn't ever stretch into pain. It's a whole different type of stretching. Progressing your flexibility like you would do in gymnastics or martial arts is a different type of stretching than we're talking about, which is just to relax your muscles, to reduce pain, and to relieve tension on an area to allow you to modify your posture. Stretch number 2 is for your trapezius. The top muscles at the top of your shoulder, the kite-shaped muscle, all the way up your back. So what I want you to do is either reach your hand to the floor, roll the shoulder back so it's in line, collarbones in line with your spine, and lean your head to the side, keeping your chin still. You should feel a stretch down the side of your neck. You can wrap the arm underneath your back and gently press into the back to increase the tension. Or if you're sitting, you can wrap your hand under the chair to create a bit more tension and lean against it, or hold a weight in your hand. Some therapists will teach this as an option. I really dislike this. If your body's trying to protect itself, stopping you doing damage, it's going to shut the muscles off as a protection. But it's being stretched here, so it's going to shut this arm off. So you doing this is potentially dangerous for not a whole lot of benefit. Whereas actually what you could do is gently put the thumb on the chin to give yourself a pivot, pull the arm down and back, so it goes down and back, lean the ear to the shoulder, and that's as deep as I need to be. If you're not feeling that, I would suggest it potentially doing the stretch wrong. Modifications for this stretch can be to gently lift your chin to the ceiling, looking up, and pulling the ear further towards the tip of your shoulder. That will bring the stretch right up the top by your occiput, right up by your ear, and can be really good for releasing tension in your jaw and that headache area. The second modification would be to drop your chin further to your chest and pull your crown further over, which will bring the stretch right down the bottom of your neck, around your first rib, which is really good for scaling problems and problems that are radiating into your upper arm, like thoracic outlet problems. Pec stretches. So pec stretches are easiest done on a door frame. I'm going to use the window just so you can see what I'm doing, okay? So your hand goes onto the door frame or onto the wall. Your elbow also touches the wall or the door frame. Make sure your shoulders are relaxed, and as you step forward, your shoulder is going to open. So if my hand's on the door frame, you step through. Try not to twist your body, keep your shoulders drawn down, let your body open, okay? So I'm just pinning my arm, stepping forward and letting my chest open. The other way you can do it is rolling your body into the wall. So you see I rotate rather than just translate forward. I find that nicer because I'm very tight in my chest, and that stretches into here, but my shoulders are staying down. It is personal preference. This can also be done on the floor. So you put your hand onto the floor, you'll be on all fours, and you'll drop and turn through, but have a look at my basic upper body yoga. I'll go through that then, okay? I also want you to do a straight arm stretch. So same principle, shoulder down, hand slightly below the collarbone, step through the door and feel the stretch down the bicep. And obviously you can adjust the angle, or you can turn inwards to get a bit more extension. But I would argue that if you have tight pecs, that's contracting the front of the arm, which is going to cause tension in the pec and into the front of the arm as well, which is going to cause nerve irritation. Make sure you always stretch both sides evenly. One modification of that door frame stretch is to go into the corner of a room, so your body's in line with the corner, put both arms up, the shoulders down, and lean into that corner, elbows staying engaged on the wall. You'll get an even stretch both sides. If you're very tight, you're just going to twist your body on that one-sided stretch, whereas the bilateral stretch will keep you even, and you might find that much deeper for you. So try that. So for lat stretches, it's the large muscle down the side of the body, the wings, like you'd see in a bodybuilder. And its job is to pull the shoulders down into the back pockets. It's also supports with posture, but primarily it's a strengthening muscle. So what I want you to do is think about how it would work, which is it attaches to your arm, to your shoulder blade, to your ribs, and to your hip. So you need to get the length between those points. A nice stretch is onto the kitchen counter, and then just lean back, drop your head down, and feel a pull either side of your shoulders. Or do one side and add a little bit of a twist. So You pull back, and then you pull away at an arcing angle to feel the stretch. I like to drop my head to get the stretch a bit deeper, but work with your body. If you want a slightly more intense stretch, elbows onto the kitchen table, gently lean back, head down, and feel the stretch right underneath your arms. You can bring the arms behind to increase the tension to the back of the arms. And bear in mind, all of this can be done on a wall. There's no reason you can't do that on a wall. A nice spinal twist that I like to finish upper body stretching with. I know that's more for lower body, but the amount of twist that comes from the shoulders is your option. Either in kneeling hip flexor stretch, kneeling down, or standing. But I feel the more you stabilize your pelvis, the more you're going to help yourself stabilize upper body. And why would you not set yourself up for success by reducing those potential factors? So I take a nice kneel. The side I'm stretching is behind. Take my arm behind and then gently turn myself forward. Alternatively, have the arm back, but then roll the shoulder, pull my chest, but trying to keep my hip nice and still. So I'm bringing that lower body stretch we had before in the other video down my spine, rather than moving my legs to the side, which brings the stretch up my spine. So my focus is going to be on this movement with my shoulders back, and I'm trying to keep my hips level. Here. Obviously you can just use your legs, pull the shoulder and go the other way, which is primarily a low back stretch. But I feel if you get a bit of mobility, it will really, really help with your shoulder activation work. Obviously a great follow-on for this is going to be the upper body yoga video, which you can find on here, or upper body release with a physio ball or a foam roller. So take a look at those. They are progressions. If you're new to trying to get kind of injury under control, stick with this to start with, and just remember that less is more. I'd rather you did 30 seconds really gently, not sure you're doing enough, and do it 5 times a day, than stretching so hard you end up hurting yourself more and having to come back in for more treatment or having to miss more training because you were just a little bit over enthusiastic about it. If in doubt, less is more until you know where you should be. And by all means, do a video and send them in to us. If you're seeing us as you're a patient, we're here for you. Video what you're doing, send it to us, and we're happy to modify it for you or discuss it with us in the treatment room.